Hello, hi, welcome back to my channel. I am Dr. Namrata Agrawal, critical care specialist at Borivali Healthcare. So today's topic is very interesting and very less known to the people, that is brain swelling, or which is also known as brain edema. So what is brain swelling, what is brain edema, and how an ICU care helps patient recover from the brain swelling. So what is brain swelling? So brain swelling is also known as brain edema, that is the swelling or the water retention in the brain. Just like how the swellings we get on the hands or legs, it is same, the brain swells up during some disease when there is an injury in the brain. Brain swelling is a life-threatening condition if it is not taken care of at the right time. Once the brain swelling is identified, the measures have to be taken to decrease the brain swelling, because as we all know, our brain is inside a closed box. Bones around the brain or the skull around the brain acts like a closed box. So whenever there is a swelling in the brain, the pressure inside the box or the skull increases, which can be a life-threatening and can cause irreversible brain damage or even death of the patient. So it has to be identified quickly, and a critical care specialist needs to take some measures to get the brains down very fast. So now we will discuss what are the causes of a brain swelling. So there are very few common causes which can cause brain swelling. First is stroke, ischemic stroke or a hemorrhagic stroke, like the bleeding in the brain, or when there is a blood clot in the brain. Whenever there is an injury, there is an inflammation that happens inside the brain. Just like how we get cut on our skin, there is an edema around the cut. Same, whenever there is an injury inside the brain tissues swells up to protect the injured brain, to get all the repairable tissues or the WBCs, RBCs to that area, which causes the brain damaged tissue to recover, and it is a common phenomena that occurs and the brain swells up. So as we were discussing, the commonest cause is a stroke. There are some infections of the brain like meningitis, encephalitis. Sometimes we see the bacterial infection happening in the brain, dengue, malaria, all this causing swelling in the brain, which is called encephalitis or meningitis. Also, whenever there is an infection in the body, the toxins which are released inside the body crosses the blood-brain barrier, goes into the brain and causes a chemical reaction which causes swelling in the brain, which is called encephalopathy. Also, whenever there is a trauma to the brain, like in cases of road traffic accident, or whenever a patient fell down, gets an injury or the bleeding in the brain, all these causes are the commonest causes which can cause swelling in the brain. So as we had already discussed, it is a very dangerous thing that happens. Our brain swells up. The vital functions of the body, like the respiration, which is the most vital function of the body, which is controlled by the brain, it hampers and the patient may stop breathing if the swelling is too much. So that is why we need to stop the swelling or reduce the swelling or control the swelling before any vital organs are affected. Sometimes we may be late, or the patient presents to us late during the course of the event and the vital functions have already started to get affected. Then the patient may require vital supports also, or an organ support like a ventilator support to maintain the respiration of the body. So how do we diagnose that the patient has brain swelling? So there are special signs and symptoms that the patient may present with, and during the clinical examination we may find, like the patient may be drowsy, they may be irritable, they may have history of a recent head injury or a stroke, or patient may be having high grade fevers, so as to recognize that there may be some infection in the brain as well. Other than that, we may do some tests like a CT scan or an MRI, which will also diagnose brain swelling. Sometimes if these tests are not confirmatory, or we are confused if the brain swelling is there or not, we cannot diagnose through this, then we may have to put a small needle inside the brain to check the pressures of the brain and to act upon it immediately. So this is what is called as intracranial monitoring. There is a special kit available, and the neurosurgeon performs this by inserting a needle inside the brain and checking the pressure. Now, once we have diagnosed patient has a brain swelling, how are we going to tackle it, or how are we going to control it? So there are various tiers in which we do the therapy or the treatment. So tier 1 is immediately elevating the head end of the bed. The patient has to be propped up by 30 degrees or more than that, so that by the gravity, the fluid around the blood in the brain drains down and the pressure inside the brain decreases. It is not very efficient in decreasing the brain swelling, but it helps in majority of cases where there is a minimal swelling in the brain. The tier 2 is we give some medication intravenously like hypertonic saline or mannitol, which again decreases the swelling in the brain and along with that pressure. So tier 3 is where the intensivists advise the relatives to get the neurosurgery or the surgery done. So what happens is whenever the pressure inside the brain increases too much and we are not able to control either by the head elevation or controlling the pain of the patient or hyperventilating the patient or giving any medications, then we might have to do a surgery which is called as decompressive craniotomy, in which the part of the skull is cut and removed so that the brain gets the place to swell up and the pressure inside the brain decreases immediately. So this is a reversible surgery that we do, where once the pressure inside the brain and the injury to the brain that has happened has healed and the edema decreases, the pressure decreases, then we can put the skull back on and the patient should be fine. So the outcome of the patient after the surgery depends upon the initial disease that the patient has got, due to which we had to perform the surgery. Like a patient who has got stroke, extensive stroke, and that area of the brain has been damaged, then it is very difficult to tell the prognosis because the prognosis might not be in our favor. Because the damage that has happened in the brain might be irreversible. So surgery is beneficial or not, that will be decided upon the discussion between the ICU team and the neurosurgical team. But we can definitely save the life of a patient by doing this surgery. Outcome may or may not be good. That will depend upon the disease that the patient has got. So emergency decompressive craniotomy is always a life-saving surgery, where if the pressure inside the brain too high and if the patient stops breathing, then the patient will die immediately. But whenever we do a surgery, the life of a patient can be saved. But the neurological outcome, how the quality of life of a patient is going to be, will patient be back to normal just like he was before any disease, or the patient may be bedridden, or patient may have some difficulty or may have altered quality of life. These all questions we will be able to answer only once we know what the disease of the patient is. Like we discussed, whenever there is a stroke, if the damage is too much, then the quality of life even after performing the surgery might not be too good. So these things you need to discuss with the ICU team and with the neurosurgeon about saving the life versus having a quality of life. So whenever patient or relatives are in stress, they will always think about saving the patient first and then thinking about the quality of life. But sometimes we may have to take a hard decision depending upon the disease that the patient has got and decide if we want to save a life or we want to give the patient a quality of life. So this is very important. Think about it, and if you have any doubt in any of these situations, then you can definitely comment down below and I'll be happy to reply. Or if you have faced this similar situation, then you can contact me at Borivali Healthcare. You can schedule an appointment and I will be happy to guide you or counsel you about what is required during this time of crisis. So the importance of the brain swelling is very important. That is why the patient needs to be observed continuously in ICU. Even if the patient has slightest of brain edema, patient might be talking to you, but if the doctor suspect that the patient may get brain edema, it is always better to get them admitted in ICU, keep them under observation. So whenever the signs of brain swelling are there or the brain swelling increases, then the doctors are there immediately to respond to that, and we can save the patient along with giving them the quality of life. Thank you for watching my video. Hope you like it. Please like, share and subscribe to my channel. Thank you.